Okay, I think we can start now. Thank you all for joining us. Thank you for all our panelists to be connected, to have taken part of their time to be available today to share their experience on how companies in Africa are tackling the ongoing challenges of COVID-19. Earthworm Foundation was founded in 1999. We are working across 5 continents with ground-based projects. We are a member-based organization with almost 100 members companies. Our expertise is mostly in social and environmental challenges across the world. The Center of Social Excellence is an initiative of Earthworm Foundation. It was created in 2008 to solve problem between agro-industrial concession, forestry concession, and their communities as well as their workers. As of today, the Center of Social Excellence has trained more than 300 graduates and professionals across West and Central Africa. They are young people, professionals that who are able to navigate conflict and build strong relationships with local stakeholders, including workers. Next slide, please. So our today's speakers, we have Joel Linkyo, who is Senior Manager for Earthworm Foundation. He's going to present us his analysis of occupational health and safety risk in this COVID time. We have Mr. Wenceslas Nubi, who is a Corporate Social Responsibility Manager for Susukam, who is one of the main employer in the agro-industrial sector in Cameroon, who is going to share his experience of COVID among workers and communities. We also have Mr. Taiki Foka Simon, who is psychologist. He's going to present us the stress management in companies. And we have Mr. Eric Ngachu, who is the regional lead of Earthworm Foundation for Africa. He's going to present the management of worker rights in plantations during a health crisis like the one we are encountering today. Desiree Ndumu will be the moderator for this session. I'm the project manager of the Center of Social Excellence. Thank you. So before we started this webinar, we have decided to launch a survey for forestry concession and agro-industrial concession across Africa to gather experience. And from the responses we are able to get, we have more than 40,000 workers that are impacted by the operation of those companies who responded to our surveys. They are covering more than 951,000 hectares of concessions. Most of our respondents are working in the palm oil sectors. 33% are in the rubber and wood and cocoa. 25% are in the sugar sector, coffee, vanilla. And 32% acknowledge that they had cases of COVID illness in their companies, while for 68 said there were no cases reported. On the impact of COVID on those companies, they highlight the fact that COVID has impacted the financial health of their companies, as well as plantation and factory work. Then there was one case of conflict with workers and communities that was reported by a company. That company is in the timber sector, and the conflict was mostly linked with restriction of movement in the concession. So about the major challenges that those companies were encountering, the main challenges, that is for 53% of the companies, is related to respects of barriers measures by workers, as well as all the communication system that's linked with this respect of barriers measures by workers. The other challenges that come second for companies is the additional funding to cover the COVID-19 expenses. And for minorities, 16%, the food and raw material supply challenge were difficult to overcome. Some of those companies received support, mostly from the government in Liberia, in Cameroon, Ivory Coast, DRC, Nigeria. The government have been able to help some companies in providing PPE, posters, and trainings. Some companies receive support from NGOs, and others receive subsidies from in the cocoa sector in Ghana. Okay, to end this survey, we share with you the measures taken by companies in Africa. We were able to notice that all the companies have set up measures related to hand washing station available for the worker, distribution of masks to worker, temperature also systematically measured, provision of alcohol gel also for the workers. All the companies stated that they have set up these measures. Others said in addition, they have also restricted movement. They have provided additional measures in their health centers, reinforcing them, training their health personnel, providing PPE. And a few companies, 10%, have opted for the systematic testing of workers. I think it's the case of Sosukam, construction of isolation centers, provision of support for those workers who are tested positive. Some of the additional measures for the companies were the closure of school within the concession, rotation in the office, providing support to key stakeholders. I think this is basically what we gather from this survey. And we are going to make sure we are going to share with you the full result of the survey. Thanks for all companies who participated to this survey. So why this webinar now? The world has spent some difficult moment with the COVID crisis, but we are turned now in the future. If this kind of crisis happen again in the future, how are companies going to react? So we wanted to propose proactive measures for the companies. And one of the outcome of this webinar and the survey will be to produce a knowledge product for companies. So for your question, please, at the bottom of your screen, you will see the Q&A sign. Please just write your question, and you put at Erit or at Wenceslas, at Simon, at Joel, and your questions are going to be answered. Thank you. So our first speaker is Joel Linkyo. Joel is Senior Manager for Edwam Foundation. He has worked for many years as in audit certification scheme for Bureau Veritas. And now since 2 years now, he has joined Edwam Foundation. So Joel, you have the floor.
Thank you, Desiree. Good afternoon to all the speakers. Good afternoon to all the people who are connected and who are listening to us now. So I'll be talking about analysis of occupational health and safety risks related to COVID-19. So when we talk about risk, we need to remember one thing. The risk globally is the effect of uncertainty or anything that can prevent you from achieving your objectives. So anything that can prevent you from achieving your objective can be considered as a risk. But when we talk about occupational health and safety risks, there are two main elements that we need to integrate. The first element is the hazard. You need to have an hazard. For example, a virus can be an hazard. A knife can be an hazard. The second element to be considered is the exposure. So if you are if there's any possibility that we can be exposed to an hazard, then we can talk about the risk. Now, the gravity of the risk will be related to the environment because we are interacting with our environment. For example, when someone would like to cross a road, it's not going to have the same attitude when it's raining or when there's a sunlight. It then for the person who is driving, you want to cross the road and someone is driving. The driver will consider the weather because if it's raining or if you have a sunlight, the driver will have to adjust himself, and you also want to cross the road, you have to adjust yourself considering the environment. The company also live in that kind of environment. So the company actually have interaction with the environment, and the ecosystem where the company is living can be divided into two parts. You have the external environment and you have the internal environment. The internal environment is made, for example, by the workers with the policy and all the procedure that the company has in place. And the external environment is made by the supplier, you have the shareholder, you have administration, you have NGO. So the company is interacting with all those stakeholders who are part of the environment. Now, the way that the company is managing that interaction can lead to an opportunity. If the company doesn't manage the interaction very well, this can lead to a threat. It can generate some negative risk, which is going to impact the company reputation. So all those stakeholders interacting with company have their expectation, or they have their need, they have their requirement. So it's very important for the company to consider the expectation and the need of those stakeholders and try to integrate it in the management system. For example, if you take the case of the NGOs, they need for organization cooperation to achieve environmental and social objective. This is what the NGO needs. So if the company doesn't respond to that, the risk is the boycott for non-compliance, for example, and that can lead also to a campaign. I'm not saying that what the NGO say in the campaign is always true. What I'm trying to highlight is the fact that when the NGO have said something, whether it's true or no, the damage are already done. But if the company is acting in a proactive way with NGO, for example, having in place a grievance management system, having in place a transparent process to solve our grievance, then this opens the door to discussion and collaboration, and this can really improve the image of the company. So actually what we are asking to the company to really do is to make sure that they have identified all their stakeholders, they have identified the requirement or the need and expectation of the stakeholder, and they also identify the risk related to those stakeholders. By considering all those elements, you can really integrate the risk approach in the decision-making process internally. So when we talk about risk related to COVID, so it's not possible for us to have in place a good strategy to avoid to avoid the spread of the COVID if you don't consider all the stakeholders. For example, there's no border between workers and communities. If you put in place control measure for your employees, then you don't put anything in place for the community, then the employee can go back in the community and break the virus inside the company. Today, stakeholders are also considered as a source of a risk. So if you want to put in place a correct preventive measure, we need to consider our worker internally. We need to consider our stakeholder, who could be the community. The stakeholder could be administration, who have in place some protocol regarding how we are going to manage people affected. So by acting that way, we can have a very integrated process in play, a good strategy that will help us to prevent the spread of the disease. So, so what does that mean normally? What we are expecting here, the first thing to understand here is that the COVID-19 spread from people or from contaminated surface. Now, if we need to integrate that risk related to COVID in our management system, we need to consider all the process and activity in our company. I'm talking about all the process on our activity, not only production like we always see in some company, where we need to consider production, we need to consider management process, we need to consider support process, and go through all those process or activity and try to identify what are the probability that worker can come into contact with someone who is infected, or worker can come in contact with a contaminated surface. This will help us to identify the potential risk and put in place the appropriate control measure. Because what we have identified when the COVID started, the government came out with many rules. We were very good, and the company just grab them and implement them directly internally without checking if there's anything missing, if there's anything that needs to be adjusted. We have an example of a community that we visited. The company decided to support the community and provide the community with bucket and soap. But when we visited the community, we noticed that that community didn't have water. So if you give them water and soap, if you give them bucket and soap, how are they going to use bucket and soap if there's no water? This means that the implementation of the control measure need to consider the context. It need to come from the analysis that the company has conducted internally and externally. Next. So here you have some example of control measure that can be put in place. For example, the risk of being infected if you are in contact with someone, then as a control measure, you can, for example, work from home. You can observe social distancing. You can modify the start time or the end time of your shift, or you can also decide that visitors are not allowed in your workplace. So those are some examples of the control measures that are existing now and that many companies are actually implemented. Next. But those control measures fall inside what we call the hierarchy of control. So what I'm trying to highlight on this slide is the fact that the protective equipment is the least effective. As you see, we start from the most effective, which is eliminate the hazard, to the least effective, which is protective equipment. But today, what we usually see is like when there's any risk, then the company will quickly go and provide PPE to the workers. But if you provide PPE to a worker without explaining to that worker how to use that PPE, you are not actually helping him, because if he doesn't use that PPE appropriately, it's not going to protect him effectively against the danger. So the idea here is for the company to see how you can integrate all those hierarchy of risk control according to your context to have a maximal protection. So here is quite important, as I said at the beginning, when you are analyzing your risk, to consider the risk related to the stakeholder and also consider the integration of the hierarchy of control. Thank you.
Thank you very much, Joel, for your contribution. Thank you. Welcome also for those who just joined us. Our present speaker is Mr. Wenceslas Nubi, who is Corporate Social Responsibility Manager for Sosucam. He has worked for some years in a logging company as a social manager before joining Sosucam since more than 6 years now.
I'm desired to give me the opportunity to share with the participants of this webinar the experience of Sosucam on the management of COVID-19. About Sosucam, Sosucam is Société Sucrière du Cameroun. We are based in Cameroon, Center Region, Banjok, Cotin, and Lembe subdivision. Our activity is sugar production from sugarcane farming, granular and cure. We are on about 25,000 hectares of sugarcane farm plantation. We are employees. We have more than 7,000 employees, including more than 1.2 permanent and about 6,000 temporary workers. Next, please. Talking about COVID, the objective was protect, communicate, and support. SOCICAM and its employees are engaged in the fight against the pandemic and support those affected by the disease. A business continuity plan has earlier been put in place to organize the maintenance of our production while preserving the health and safety of the staff. Next, please. Abide protected. We, SOCICAM, have put in place a daily temperature measurement, installation of hand washing point, distribution of hand sanitizer and personal protective equipment, regular disinfection of transport and production unit, dedicated team for disinfecting material and lines. Next, please. And finally, communication to all our environment. Poster campaign through the site in order to raise awareness from the pandemic. A charter adapted to new health measure on training of worker. Control plan set and run daily by a dedicated team. So we put in place a team named safety zone, who have put another team who is checking the respect of distanciation measure called control team, who is working on the, and that are all the measures taking place by SOCICAM to maintain the COVID-19 pandemic far from our unit. Thanks for your attention.
Thanks, Wenceslas, for your contribution. Our present speaker is Mr. Taiki Foka Simon. He's a professional psychologist in mental, psychic, and gerontological disability. He's also a clinical psychologist and specialized educator. He has been greatly involved in managing the COVID-19 situation in Cameroon so far. He's working in the Yaoundé Central Hospital. Thank you. Mr. Taiki, you have the floor.
Okay, thank you, Desiree. Thank you to give us this opportunity to say something about stress during this COVID-19. I want to say something. My English is not well, but I can say something. Okay, to begin, I want to give the definition of mental health. Mental health is the state of well-being, allowing every individual to fulfill themselves, cope with the stress of life, and to make a contribution to the community. Stress is defined as the body physiological response to an exhausting, dangerous, or distressing situation. We want to say that in society or at work, stress is an adjustment disorder that occurs when professional demands make it impossible for an individual to be adapted to their environment. Next, please. Symptoms of COVID-19. Physically, we have fatigue, muscle tension, headache, palpitation, difficulty of sleeping, digestion problem. To emotional, we have a desire to be alone. To behavior, we have irritability, feeling out of control, social withdrawals. Cognitive, we have a limited thinking capacity. International, we have interpersonal, we have unable to understand one another or what is happening. So spiritual, we have withdrawal from spiritual activity, lack of motivation toward what is spiritual. Next, please. Stress management. First, we have to identify the cause of stress to cut the problem at its roots. Second, we have to know the right information about COVID-19. Make exercise and stay positive. Eat food rich in antioxidant and vitamin C. Take break where is possible. Next, please. Communication. During COVID-19 pandemic can be isolate people in fear and anxiety. So we have to listen to and take care of our colleague or your colleague. Make sure they are in good psychological and mental health. Communicate with them in a clean and optimistic manner. Identify any issue constructively together. Next, please. We have to rely only on reliable, credible source of information about COVID. Don't continuously monitor the news. It will increase your stress and may reduce your efficiency and overall well-being. Monitor your condition over time to detect any symptoms of depression or stress. Take to a peer or supervisor or seek professional help if needed. Share your frustration and solution. Thank you, Desiree.
Okay, thank you, Simon. I think you make a very great effort. Welcome again for those who just joined us. Our next speaker is Mr. Eric Ngachu, who is a regional lead for Edwom Foundation in Africa. He has more than 20 years experience working across Africa. Eric, you have the floor. Thank you.
Thank you, Desiree, for giving me the floor. I have a few minutes to present the worker rights on the COVID-19 pandemic. So basically, we have, in terms of background, worker rights suffer from some particularities, especially in agro-industrial and forestry sector in Africa. The labor market are very weak. And also, I think we can also consider the fact that the law enforcement is really ineffective, and the labor inspection also is really, really weak. So before COVID-19 pandemic, worker rights were already a challenging issue in these sectors, although we can acknowledge the fact that many agro-industrial and forestry companies are implementing a lot of effort to improve the situation. Also, the seasonality of the agricultural production add to the challenge of the extending social protection coverage to agricultural workers. So basically, considering this background, we can still say that because these workers, they have family, they have kids under their responsibility, they have no choice than to continue to work under these difficult circumstances. So what it is important to mention the fact that most of the time is not always the case. Workplace incidents do not always cover the subcontractor workers. In this particular time with COVID-19, strengthening the occupational health and safety by adjusting some work arrangement is necessary. For instance, preventing discrimination and exclusion, and providing access to healthcare, pay leave, and all part of the coordinated health and social response to the crisis. This is not always the case because, first of all, most of these workers, they do not even have a written contract, which is one of the core requirements of the various contexts where they are working. One of the characteristics of this category of worker is the lack of access to remedy. Most of the time, the company develop access to remedy, especially for permanent worker, but this, due to the seasonality there is not a proper system dedicated to this category of workers. So if they have any concern, it's really difficult to reach out to the management. This is one. And also the fact that their direct employer are not always in compliance with the legal requirement. So one of the critical point is to start by giving them a written contract in the language they can understand, but also extend the coverage of workplace incident insurance to this category of workers, which is not always obvious. I think my previous colleague always present some of the measures related to implement, to prevent the COVID contamination. But we almost know that the accommodation conditions of the agricultural workers are not always very good. So company need to see how to improve their accommodation condition, because when we talk about observing some restriction measure, observing some distancial measure, this include the standard of the accommodation you have, and this is a fact, especially the agro industry and forestry company. The accommodation are not always on the top, although many companies are doing a lot of effort to improve that. Access to clean water, as we know, especially in this remote rural area, is a challenge. So really observing some of the core rules against COVID-19 is not always obvious. So companies should make available clean water to workers and family. Most of the time, agricultural workers, they are living close to the surrounding. They are living either within the community or they have their camp. And as I said earlier, their accommodation condition is not always on top of the standard, we can say. Although many companies, they are trying to improve, but this is really a challenging issue. Thank you.
So thank you, Eric. Thank you to all the speakers. I think it was all the different interventions were very straight to the point, very useful. I think we have a few questions in the question and answer. We have a first question for Simon, our psychologist. Simon, what would you recommend to a colleague who recently got COVID and has to go back to field work. So Simon will answer in French, then our interpreter will repeat in English. I'm sorry for the inconvenience.
Alors là, Désiré, il faut logiquement quelqu'un qui a été Covid plus et qui doit reprendre un travail, cela ne devait pas poser problème. Le problème naît justement parce que à un moment donné, surtout ici au Cameroun, être Covid plus était un peu perçu comme une fatalité. Ça fait que des personnes testées Covid plus sont stigmatisées et rejetées par la société. Du coup, pour pouvoir réintégrer cette société, ça devient un problème. Donc, pour pouvoir...
Okay, actually, I have been COVID-19 positive. This is not actually an issue because once you are recovered, for example, in Cameroon here, the problem was that when you got infected, you suffered from some stigma from the society and maybe your family. So actually, it should not be a problem once you are recovered from COVID-19.
Là, donc, ceci nous amène à dire qu'il faut non seulement donner des conseils à la personne qui stigmatise, mais également rassurer la personne stigmatisée. Donc, vous comprenez que pour pouvoir donner en toute aisance une réponse, il faut prendre en compte les deux aspects, c'est-à-dire la personne qui stigmatise et la personne stigmatisée.
So if you have to say something, you have to recommend something to a colleague who recently got COVID, you should actually focus on both sides. The person who got infected, who was stigmatized, and the other way around, the person who was stigmatizing, because we have to raise awareness.
Pour les deux parties, ce qui est important de savoir, c'est-à-dire la personne qui stigmatise et la personne stigmatisée, c'est que le COVID, ce n'est pas une maladie de la honte.
Okay, what you should know first, you who got COVID-19, is that COVID is not an illness of shame. It's not a shameful issue.
C'est une maladie comme tous les autres. Une fois la quarantaine finie, on reprend son travail parce qu'on est testé négatif et on a un test qui nous permet de pouvoir reprendre nos activités de manière normale.
It's a disease as other diseases. Once you have recovered, you can go back to work. Once you have recovered, it's okay. You can do another test and that you will be tested negative. So it's not an issue which is too serious once you have recovered.
La personne stigmatisée doit toujours se dire que la société aura un regard défavorable vis-à-vis d'elle. Mais cela ne doit pas l'empêcher de continuer son travail parce qu'elle est arrivée justement en entreprise parce qu'elle a des objectifs à atteindre.
Okay. The person who was stigmatized because of the illness should not keep that in mind because that's how the society is. But the person should keep in mind that they should do their work despite the stigma of the society.
Alors, c'est plus que jamais pour la personne stigmatisée de marcher la tête haute. En fait, elle a été testée positive, elle connaît son statut. Elle devait se réjouir d'avoir reçu un traitement et elle peut protéger les autres. C'est très important.
Actually, the person who was tested positive should rather be happy because the person knows her status, the person has recovered, and now the person can work properly.
Donc, c'est ce que nous pouvons dire par rapport à une personne qui est censée reprendre son travail après être testé positif. En fait, le regard de la société ne doit pas interférer dans ses objectifs à atteindre au sein de la société.
Okay, so in conclusion, in a nutshell, what we can say is that the perception of the society should not interfere on your work in the company.
Comme nous le disons, si ces personnes ont des difficultés malgré cela à pouvoir intégrer de manière logique leur entreprise, elles peuvent juste rencontrer un psychologue et pouvoir s'entretenir avec lui.
Okay, and if the person still faces issues regarding that stigma, the person can still seek help and meet a psychologist.
Okay, thank you, Simon. Thank you, Elodie. So the next question is for Wenceslas. Do you happen to have a story about what the company can do or contribute to local communities during COVID-19? So Wentz will answer and then Elodie will.
Ok, bon, je vais Donc, tout à l'heure, dans ma présentation, j'ai parlé des actions de sensibilisation d'abord en termes d'action en direction des communautés. Donc, la sensibilisation n'a pas concerné que les employeurs, les travailleurs, mais aussi les communautés.
Okay, first of all, let me say that during my presentation, I talked about awareness, and we raised awareness not only to the workers, but also within the community, the local populations.
D'un autre côté, nous avons apporté du matériel de lavage des mains, un savon pour les communautés. En plus de cela, nous avons mis en place une synergie. Comme nous ne pouvons pas contrôler les mesures barrières à l'extérieur de notre site, nous avons mis une synergie en place avec l'autorité administrative locale et l'autorité sanitaire locale pour pouvoir accompagner ces partenaires dans la lutte contre le COVID à l'extérieur de l'entreprise.
Okay, since we cannot control what is happening, what is happening outside the company, what we did is that we first of all distributed soaps, hand sanitizer, and all equipment to fight the disease. But we also had to set up a synergy with local administrative and health authorities to build up an action that was holistic to fight against the disease.
Le orateur a bien parlé, a levé le fait qu'il n'y a pas on ne peut pas avoir de barrière entre l'entreprise et les communautés. Nos travailleurs, quand ils partent de l'entreprise, ils sont à l'extérieur de l'entreprise, ils sont mélangés à l'ensemble, d'où la lutte réussie contre cette pandémie ne pouvait passer que par des actions intégrées à l'ensemble des parties prenantes à notre activité.
As the first speaker rightly said it, Joel, when he was talking about hazards, there will always be a contact between the factory and the local population because once they get out of the factory, they go into the local populations. So there is a need for integrated action to fight against the disease. Okay, thank you.
Thank you, Wens, for your contribution. So the next question is for Joel. Joel, what do you see as some of the highest hazards in terms of safety during COVID for agricultural companies?
Yes, thank you for the question. As I said in the presentation at the beginning, the level of hazard will really depend on the environment where the company is operating. But I will just insist of the high potential source of contamination, for example, with the experience that we have with agriculture companies. We have noticed during our visit on the field that, for example, in the morning, in many companies, workers usually go to an assembly point. And with this COVID crisis, it became very difficult for some companies to manage that assembly point because some of them have to reduce the number of workers who are attending to the assembly point, or some of them have to organize in such a way that some workers can go directly to the field. The second potential high zone of contamination was also the transport. You will notice that some companies have to reduce the number of workers that they are transporting in their cars so that they can respect the social distancing. So the level of the hazard here is going to be really linked to the environment. But those two key points that I highlight, those are the main issue that we have noticed in many companies that we visited during this crisis. Thank you.
Thank you, Joel, for your contribution. We have another question for Erit. What is the role of labor union in companies in Africa to try to mitigate the risk faced by workers? How do they defend people who lost their job without compensation, for example, or other risks related to health and safety?
I think, first of all, in most of the country where we conduct visit in agro-industrial company, the national law, labor law, provide one of the role of the labor union is also to represent and to air out some of the worker concerns related to health and safety. But our experience is that this representation most of the time do not really cover the casual workers, because I made an emphasis on the casual workers, the daily workers. Most of the time, because they are managed by the subcontractor, their representation are really weak. So one of our core recommendation in this is to ensure that these casual workers are very well have a representation and they can access management. This is one. And also all the health and safety awareness activity reach out to this category of workers. So how do they defend people who lost their job without compensation? I think, yes, this is really one of the governance issue I would say we have, because especially the casual and daily worker, they do not have representation. And as I mentioned in my presentation, they do not, most of the time, they are not part of the remedy process in place, I would say. And the grievance management system in place do not really capture their concern. And most of the time, especially exceptionally in some cases, they can be captured, but most of the time they are not, they are just abandoned to themselves. So it's really challenging, especially when we talk about the dailies and casual workers. As I mentioned, because they are not really represented in terms of, they do not have labor representative in terms of union, although the laws, the national law provides that. And also the access to remedy. I think those two elements are really crucial.
Thank you, Eric, for your answer. So I think it was the last question. We are also short of time now. I want to thank everybody, everyone who has attended to this webinar, all the panelists, and all those who are following us also on Facebook, on the different social media. Thank you, everyone. Goodbye.